Okay, today we're going to go and we're going to talk about the portal venous system and all its tributaries. So the portal venous system is a really cool system. It's a very unique system. It's actually a completely separate flow system from the aorta and IVC. And what it does is it pulls blood from the spleen, the small and large intestine, parts of the GI tract, parts of the stomach, and even parts of the pancreas. And it goes through and it supplies the liver with roughly about 80% of its blood supply. So I really want to go through and show the overall coursing on how the portal venous system works. Now, the portal venous system, as I said, is a separate flow system from the aorta and the IVC and their branches and tributaries. And this system actually lies in front of or anterior to the aorta and the IVC. So they're never going to really cross paths directly. But I'm going to start from the left side and work my way over, ending in the liver. So essentially on the left side, left upper quadrant, we know that we have our spleen. So we have our spleen over in our, again, left upper quadrant. Now, if we go back and we think about the blood supply to the spleen, we know that the left branch off the celiac axis is the splenic artery. That goes through and it gives the spleen its blood supply. However, we need a vessel that's going to go through and take the blood and drain the spleen, and that's where we get our, you guessed it, splenic vein. However, the splenic vein doesn't dump into the IVC like a lot of our other ones do, such as the renal veins. It actually goes through and it's a part of the portal system. So the splenic vein starts lateral in the left lateral portion of the body, and it starts to course medially or towards the center of the body. So that means the blood supply is essentially going from left to right towards the liver, or again, hepatopedal flow. And before it gets to the liver, before we get into the liver, it has a couple different tributaries that go through and terminate into the splenic vein. So I'm going to write splenic vein right here, splenic vein. So the first tributary, first little vessel that's going to go through and dump into the splenic vein is going to be the IMV, or inferior mesenteric vein, IMV. Now, typically with ultrasound, we don't visualize the IMV, but anything is possible. No always or never in medicine. So it's going to go through and it's going to pull blood from the GI tract, specifically the large intestine, mostly from the large intestine. And again, it's going to go through, and that course of blood is going to go from inferior and travel superiorly until, again, it dumps right into the splenic vein and keeps going towards that liver. So again, we are still coursing from lateral to medial, going towards the right-hand side. And then the splenic vein is actually going to converge with another vessel, a little bit larger of a vessel, called the superior mesenteric vein. Now, the superior mesenteric vein is going to take blood from both the small and large intestines. And again, same thing. It travels from inferiorly and courses superiorly. Again, all working its way towards that liver. Now, once the splenic vein and the SMV merge together, you can see right here, they basically tee off at like a little 90-degree angle. We have this little area right in here called the portal splenic confluence, or PSC for short. So the portal splenic confluence, again, is the convergence of the superior mesenteric vein, which takes blood from the intestines, and the splenic vein, which takes blood from, you guessed it, the spleen. So again, the blood is going to go through and it's going to keep going. We got that portal splenic confluence. It's going to keep going towards the liver, or again, that hepatopedal flow. Before it gets into the liver, it's going to branch off and become like a little trunk called the main portal vein. And that's actually the portion that enters the liver through the porta hepatis. So again, main portal vein. And it's going to supply the liver with roughly 75 to 85% of its blood supply. Then the liver is going to go through, take that blood, detoxify it. Has a lot of different little functions with it. But so again, that main portal vein is part of a portal triad. No, there's 3 different parts of the portal triad. I also like to call it my Mickey Mouse sign, which we'll draw down here, and then we'll go through and label in a couple minutes. But we have our main portal vein here. So that main portal vein, again, it's part of our portal triad. And again, that main portal vein is going to continue to course into the liver through the porta hepatis. And then once it gets into the porta hepatis, it's going to tee off, almost again another 90-degree angle, and become the left portal vein and the right portal vein. So we have our left portal vein here, again, towards the left-hand side, and the right portal vein towards the right-hand side. And again, this is the patient's right. Obviously, if you're looking at the screen right now, it's not your left, it's your right. It's the patient's left and right. So further along, we have this left portal vein, again, that is pretty much a bifurcation from the main portal vein, a little bit of a tee off. And that left portal vein is going to further branch out into medial and lateral segments. So when we think of medial and lateral, typically we go through and it's in regards to the body. However, in this particular scenario, we're in reference to the organ. And again, our organ of interest is the liver. That's where all of this is occurring. And I'll draw the liver around all this once I'm done. So the left portal vein, again, has a medial and lateral branch. The lateral branch, again, goes towards the medial aspect of the body, but towards the lateral aspect of the liver, where again, the medial portion of the left portal vein is going towards that meaty portion of the liver, towards the right-hand side, because again, that right lobe of the liver is a little bit better or bigger. So again, that medial left portal vein is going to go towards the bigger bulk of that organ. Then again, going back down, we have that right portal vein. The right portal vein is going to go through and it's going to branch into anterior and posterior segments. And again, if we think of our screen orientation for ultrasound, this is basically what it's referring to. We have the anterior portion and the posterior portion of the right portal vein. And again, with that, the left is going to split into medial and lateral. The right is going to split into anterior and posterior. You'll find that's a pretty common theme with the left and the right lobes of the liver and how they're broken up. There's a couple different little things that we'll learn about. But again, goes through, travels into the liver. I'm going to draw the liver nice and around, do purple liver. So essentially what's going to happen, and if we think of our screen orientation and transverse especially, this kind of all makes sense because again, if we think of our screen orientation, we would have the top of the screen be anterior and the bottom of the screen be posterior, which again, if we have our anterior portion of our right portal vein here, and then our posterior portion here, again, that correlates with our screen orientation. And then we have medial and lateral left portal vein, and again, that's in reference to the liver itself. But again, in transverse, we have right and left. So again, medial and lateral in the body. So going through again, we have the main points to take away is the portal splenic confluence is formed by the SMV and the splenic vein. Then it goes through and becomes that main portal vein. And again, we're going to talk about the portal triad here in a second. The main portal vein, again, enters the liver through the hilum of the liver, through the porta hepatis, and branches off into right and the left portal vein. The left further goes and separates into medial and lateral, and the right separates into anterior and posterior. Now going through again, I'm going to leave this overview and I'm going to go through and kind of explain the Mickey Mouse sign and then just touch on a few key little fun facts before I end this. So the main portal vein again is part of that portal triad. Now we have two other portions of that portal triad. We have the hepatic artery and then we have our common bile duct. So if we think again about our screen orientation, there we go. If we think of our screen orientation and we look at this Mickey Mouse sign, again, always use this when asked questions in regards to the coursing or the orientation. If we look at this, the hepatic artery sits anterior to that main portal vein and to the left, which is going to be medial in the body for this particular scenario. So again, this is in regards to the body where, again, the portal veins, the left portal veins are in regards to the organ. So here we go. So the hepatic artery sits anterior and medial to the main portal vein. Now, again, if I turned around and said this different, the main portal vein lies posterior and lateral to that hepatic artery. That's why knowing what this Mickey Mouse sign looks like is important in knowing the orientation, because again, you can be asked different questions in many different ways. Now, think about what we just explained with the hepatic artery, how it's anterior and medial to the portal vein. How does the common bile duct lie compared to the main portal vein? Or again, the CBD, how does that lie to the main portal vein? Take a second and think about it looking at our screen orientation. So the common bile duct is in front of or anterior to that main portal vein, and towards the right or towards the lateral aspect of the body. So again, knowing this Mickey Mouse sign and knowing that these are the structures that lie within that portal triad and this is how they essentially lie within the body is very important. And I personally think it makes it a little less confusing when going through versus trying to, memorize, hey, this directional term versus this directional term. As long as you know this image and you're able to label it correctly, you should be able to go through and by proxy be able to be like, hey, this is how it lies, compared to this hepatic artery compared to the portal vein, common bile duct compared to the portal vein compared to the common bile duct, etc. So again, we're just going to go through, this is the overview of the portal system. It seems to be very confusing when you're scanning it, but in all actuality, it's very simple. Again, we have the IMV, which is not typically visualized by ultrasound, that dumps right into the splenic vein, keeps traveling in a hepatopedal manner towards the liver to converge with the SMV. The splenic vein and SMV converge together to form that portal splenic confluence. And then there's a little trunk out that goes through and formulates that main portal vein that enters the liver, where it goes and branches into right and left. The left goes into medial lateral, the right goes into anterior and posterior. So now I'm going to go through and talk about how this lies in regards to the pancreas, because the pancreas basically just sits right on top / wraps around the portal system right in the middle. So what we have is our pancreas, and again, get the head of the pancreas, bear with me. Here we go. So if I go through, this is essentially what you're going to see. And I'm drawing a little bit of shading over it because, again, the majority of the pancreas is going to lie anterior to the portal system, however, not all of it. So again, we're just going to go through and do a little bit of cleaning up. So again, if you're looking at this, the splenic vein lies posterior or behind a good majority of the pancreas, mostly the tail and the body, because right around the area of the neck, that's where the portal splenic confluence occurs. So what happens is the portal splenic confluence is going to be just medial to the head of the pancreas. You will go through and see it, and again, I'll do a quick little ultrasound picture on what it's going to look like, but it's very comparable to this. So again, the splenic vein is going to lie behind or posterior to the pancreas, where the portal splenic confluence is going to lie medial to the head of the pancreas. Now, what happens is we have what we call, I call it my little cheeseburger sign. You guys will see that I like food. We can't forget about the SMV. The SMV is here, but we're like, oh no, what does it do? How does it course? Well, again, my little cheeseburger happens, and what we get when we turn sagittally on the head of the pancreas is what we'll get like I'm sorry, not the head, the neck of the pancreas. What we'll get is a cut that looks like this cheeseburger cut right over here, where we'll have the neck of the pancreas anterior to the SMV, and then the uncinate process posterior to the SMV. So what essentially happens is the pancreas, once it gets to the neck, that portal splenic confluence occurs, that it kind of wraps around the uncinate or the SMV. And so what it does is the pancreas oftentimes, especially even looking at this picture, it looks like an up and down picture. It doesn't lay like that. It lies front to back in the. So what the uncinate process does is it essentially goes through and wraps around the back of the SMV or posterior to the SMV, and that's how we get this little hamburger / cheeseburger image. Because if we think of our screen's orientation, and again, I just mentioned now we're in sagittal, which means our notch is pointing towards the head or superiorly, and the opposite would be true on the other side. We haven't changed our approach, so we're still anterior and posterior. So again, if you think of this image, the neck of the pancreas is anterior to the SMV, where the uncinate process is posterior to the SMV. And again, you will only be able to get this image when you're in sagittal. The only way to get a long axis of the pancreas is in transverse. So again, pending our different cuts, this is what the sagittal cut of the neck and the uncinate process is going to look like. Once we get into the pancreas, you will see this again, and we will do different cuts of the pancreas as well. But for this example, for the portal splenic confluence lecture, again, the big things to take away is the splenic vein lies behind or posterior to the pancreas, the neck and the body, or I'm sorry, the body and the tail. And then the SMV lies between the neck and the uncinate process. So the neck again would be anterior and the uncinate process would be posterior. And then the last little fun fact is the portal splenic confluence lies medial to the head of the pancreas, which again, the exact opposite would be true. The head of the pancreas is going to lie lateral to the portal splenic confluence. So again, we're just going to go through, I'm going to leave this up for one more second, so if you guys need to take any extra notes, and we'll go through. I'm going to go through and erase my screen, and then again, just do a couple little fun facts. So again, roughly about 80% of the blood supply, I'm going to do 75 to 85. Personally, I like a little bit of a range with mine. Different sources will tell you different things. So 75% of the blood supply to the liver is going to be through the portal system. And again, that portal system pulls blood from where? The GI tract, the intestines, the stomach, again, a small and large intestine, spleen, takes the blood away from essentially the digestive tract, the GI tract, and feeds that blood to the liver. Most of it's deoxygenated, and that's where, again, the detoxification occurs. And then roughly 15 to 25% of the blood supply, the rest of it, is from the hepatic artery. So the hepatic artery and the portal vein, by default, again, they go through and feed the liver, are hepatopedal. If you said hepatopedal, you are correct. So again, 80% roughly of the liver's blood supply is coming from the GI tract, the small intestines, the large intestines, the colon, the stomach, the spleen, all of that good stuff. Now, some other things to kind of keep in mind is that the main portal vein should measure, should measure less than 13 millimeters or 1.3 centimeters. Again, they're the same thing at the end of the day. As mentioned, it enters the liver through the porta hepatis. Now, why do I care about the size of the main portal vein? Well, again, the main portal vein carries blood. If blood starts to back up, it doesn't have anywhere to go. It may cause that main portal vein to become dilated, and that's a problem. Again, if there's blood backing up and that main portal vein is extending beyond its normal range, there's something going on typically. Another thing to keep in mind, compared to the hepatic veins, which are hepatofugal because they drain the liver, the portal veins are typically brighter. Portals wear pajamas. So why? What does that mean? What happened? Well, the portal veins have a higher collagen content in their walls, so the reflection on the walls are just a little bit brighter. So sometimes, and again, not always, but sometimes this is a key way to know, hey, am I looking at a portal vein versus a branch of a hepatic vein? And again, the last thing to take away, the portal vein, the hepatic artery, and again, that CBD, all form the portal triad and enter the liver through the porta hepatis. So again, going through, if you have any questions in regards to anything, take a second, watch this video, watch it again. We'll learn about a lot of the different things in class in regards to what it looks like on ultrasound. So I'm not going to go over that too heavily right now. But again, I wanted to go through and do an overall view and overall coursing of the portal system, as well as some fun facts. But by all means, go ahead, look through your books, do some research, find out anything that maybe you find a little bit interesting and bring it to class. We can always add it to one of the lectures. But if you do have any questions in regards to any of this information that has been provided, please don't hesitate to reach out to me. And as always, have a good day.